Hello friends, welcome back. Now we are moving to the practical section of spotting. We have 10 spots here of 5 marks each, 50 marks. Total duration will be 30 minutes. This is the ideal examination pattern. So spot 1 is Levonorgestrel tablets, easy pill, and there are 5 questions given. So first question, let us see. What is the mechanism of action of the given specimen? Okay, so this is the easy pill, Levonorgestrel emergency contraceptive pill. Mechanism of action, so it acts by delaying or inhibiting ovulation. This is इसका primary mechanism. Ovulation inhibit करना या delay करना. Next is thickening cervical mucus, making sperm penetration difficult. Okay, altering endometrial receptivity, thereby reducing the chance of implantation. Because this is easy pill is an emergency pill, so its function should be to prevent penetration and prevent implantation. This is its mechanism of action. Okay, it does not terminate an established pregnancy and is not an abortive agent. Next question is mention its dosage. So its dosage is 1.5 mg orally as a single dose, and it should be taken as early as possible, preferably within 24 hours and not later than 72 hours after unprotected intercourse. Next question is, who is an eligible candidate for this method of contraception? So eligible candidate to emergency contraceptive pills are indicated for women after unprotected sexual intercourse, contraceptive failure like condom rupture or slippage, missed OCPs, sexual assault or rape, or incorrect or inconsistent use of contraceptive methods. So these are the eligible candidates, you can say, or indications for emergency contraceptive pills. Next is list one advantage and one disadvantage, and the next question is what are the instructions. So one advantage is highly effective if taken early within 72 hours. This is the window period. Disadvantage is it is not protecting against sexually transmitted infections, or we can say it is less effective than regular contraception and may cause menstrual irregularity. Talking about the instructions, so what instructions are to be given? That take one tablet 1.5 mg immediately within 24 hours, not after 72 hours. If vomiting occurs within 2 hours, you have to repeat the dose. This is very important information you have to give. Continue or start a regular contraceptive method after use. Use condoms until the next menstrual period. If the next period is delayed by more than 1 week, perform a urine pregnancy test. Do not use this as a routine contraceptive method. So this is about the first spot. Now moving to the next spot. This is the mosquito. So first is you have to identify, you have to mention 2 features, 2 diseases transmitted by it, and 4 control measures. So this is the Aedes mosquito. Identifying features: black body with white stripes, also known as tiger mosquito. Then its body is parallel to the surface. These are 2 identifying features. Disease transmitted: dengue and chikungunya, also Zika, yellow fever. Control measures: 4 control measures. So first is source reduction, prevent water stagnation, larvicidal measures, and personal protection like nets and repellents. So there is personal protection, and at community level prevent water stagnation, larvicidal measures, and source reduction. Okay. Spot 3, you have to identify the instrument and its use. Indicator: amount of bleaching powder required if third cup shows blue color, amount of residual chlorine required for disinfection of water. Mention 2 other methods of water purification. Okay, so let's see one by one. First was instrument. So this is Horrocks apparatus. Look to the image carefully. This is the Horrocks apparatus. Use it is to determine bleaching powder required for disinfecting the water. Okay. Indicator is starch iodide indicator. If third cup is blue, means we multiply it by 2. 3 2s are 6. 6 grams per 1000 liter of water is required. What is the residual chlorine required? It was asked. So it is 0.5 mg per liter after 30 minutes of contact period or contact time. What are the other water purification methods? Simple, like boiling, filtration, chlorination, UV treatment. Okay. Moving to the next spot. This is the identify the specimen. We know this is the vaccine carrier. How many ice packs are needed to carry vaccines in the specimen? What is conditioning of ice packs? So ice packs, there are 1, 2, 3 and 4 on the 4 walls. And conditioning, we'll see the definition. What is reverse cold chain? Differentiate between complete and fully, and what is AEFI. Okay, so vaccine carrier, it is 4 conditioned ice packs. Allow frozen ice packs to sweat until water droplets appear before use. Reverse cold chain, transport of specimen, example acute flaccid paralysis stool samples, maintaining the cold chain from field to lab. This is reverse cold chain. Okay. Complete versus fully immunized. Fully immunized is child has received all vaccine scheduled by 1 year of age. And complete immunization is child has received all vaccine according to age, irrespective of age. Like if a child is, for example, 16 to 24 months, whatever vaccines are to be given at that duration, the child has received it, then he or she is completely immunized. Fully immunizes, it is the child is 1 year old, he or she has received all the vaccines of 9, 10, 14 weeks, etc. Okay. What is AEFI? Adverse event following immunization. Now coming to spot 5. This is the enumerate the type of waste collected. This is the red color bag. Method for disposal, steps of biomedical waste management, and 2 PPs. So first is, it is the red biomedical waste bag, autoclave bag. Types of waste collected. We know the red bag is used for contaminated recyclable plastic waste such as IV tubing, IV set, catheters, urine bag, syringes without needle, gloves, plastic bottles, tubing and other plastic disposables. Okay. Next, coming to method of disposal, the waste is treated by autoclaving, microwaving, hydroclaving, followed by shredding or mutilation, then sent for authorized recycling. Next is steps of biomedical waste management. So first is generation of waste, segregation at the source where the waste is generated, then collection in color coded containers, storage, transportation, treatment by autoclave, incineration, etc., and then final disposal. Okay, these are the steps. Personal protective equipment, it is very easy. Heavy duty gloves, face mask, goggles or face shield, plastic apron or gown, gumboots or safety shoes. Okay, so there were 4 questions for this spot. Next spot is about the narco kit. So first is, what do you mean by syndromic approach? So it means that treatment is based on signs and symptoms without waiting for laboratory confirmation. Okay. How many different color kits are there? So there are 7 color coded kits. Recently one more is added of brown color. Next is universal precaution. So standard precautions like gloves, hand hygiene, safe disposal of showers, PPE when required. 4th is about if a patient has HIV and has not disclosed it to his wife. Will you tell a wife or not about his HIV status? Give reasons. So no, we are not going to tell directly. We have to maintain patient confidentiality. Moving to the next spot, we have to identify the logo. What is RBSK? What are the 4Ds, beneficiaries and components? Okay, so this is the logo of Rashtriya Swasthya Karyakram, RBSK. What are the 4Ds? Defects at birth, disease, deficiency, developmental delays including disabilities. Beneficiaries are children from 0 to 18 years old. Components are that screening, early detection, referral, treatment through DEIC, District Early Intervention Center, and follow-up. Okay, these are the components of RBSK. Spot 8 is rabies vaccine, as we can see. So we have to write the dose, route, schedule, categories of animal bite, and about human rabies immunoclone. So Spot 8 is anti-rabies vaccine. Abhairab is the brand name. What is the dose? 0.5 ml IM, intramuscular. Route is intramuscular in the deltoid region. Schedule by SN regimen, it is 0, 3, 7, 14, 28. Categories of animal bite is 1, 2, 3. HRIG dose, human rabies immunoglobulin dose, 20 international unit per kg body weight. Spot 9, what is the full form of DEIC? It is already mentioned in the image, District Early Intervention Center. What are the 4 Ds of RBSK? We have already done. Deficiencies, diseases, defects at birth, developmental delays, including disabilities. Enumerate any 3 points of 5x5 matrix and beneficiaries. So 5x5 matrix, 3 examples are community screening, mobile health teams, PHC, CHC, DEIC. So it's easy to remember. If the spot is of DEIC, mention it. Mention PHC, CHC, community mobile health teams, and community screening. Tertiary care referral. Then what are the beneficiaries? Children 0 to 18 years old. Okay, 5x5 matrix, I'll repeat again. There are 5 things. DEIC, PHC, CHC, mobile health teams, community screening, and tertiary care referral. Coming to the last spot, this is of swelling in the neck region. So we have to identify the disease, program, preventive measures, food fortification, facet. Okay. So this is Goitre, iodine deficiency disorder. National program associated is National Iodine Deficiency Disorders Control Program, NIDDCP. Preventive measures, universal iodized salt, nutrition education, monitoring iodine content in salt, and health education. Food fortification, what is it? It is the addition of essential micronutrients to food to improve the nutritional quality. Example, iodized salt, iron folic acid, fortified wheat flour, or fortified rice. What is FSSAI? What does it stand for? Food Safety and Standards Authority of India. So this was all about the spots we covered. Okay, thank you.